Matt, how you doing?
Good. How are you doing?
Good. So it was a surprise that you decided to run for hospital board. Was this a decision that you've been making for a long time, or tell us about your?
I think about a year ago, I decided. I first had the realization that this was a real possibility, and then I think it was about 3 months ago. It was definite that I was going to run. There were a number of different things I could have tried to try to make some changes, and so I was exploring different options, talking to a lot of people, seeing if there were other people interested in running that I could work with,
and you just decided to go for it.
Yeah, I mean,
You're
I also
there now. I guess
yeah.
that's what's sort of surprising to people. You know that you could. Have you quit, or will you quit if you win, or how does that work?
Yeah, legally you cannot be an employee of the hospital district if you're a commissioner. Right. So I would have to resign if I win. I also considered, I mean, I have a great job there. I work really closely with administration. I talk to Mike Glenn all the time. I do have, some amount of influence there, and I could have simply sort of continued to advocate for the type of changes that I really would like to see from the inside. It just sort of got to a point I realized I really wanted the hospital district to take a big step in a different direction, a big priority shift, and that's really a commission level decision. It's really a commission level issue, and so I was sort of, my option was, if I wasn't satisfied with communicating through normal channels, which an employee does, just basically communicate through your boss and through those channels, I had the option of, I could have gone to the commission as a private citizen and as an employee and sort of inserted myself in the conversation between the commissioners and the CEO and strategic leadership, and I think I could have probably had some impact that way. I think I probably could have once we start talking about the things I want to do, I think there's pretty compelling reasons to make some of the shifts. I think I might have gotten 50 to 60% of the movement that I wanted, but I realized if I really wanted this to happen, I wanted maximum movement, then I should take the whole conversation public, and a campaign for commissioner is the way to do that.
Okay, first briefly say what your job is now and how long you've worked there.
I'm a performance improvement specialist, and I've been doing that since 2008. Before that, I worked in the information systems department, and I started in '98, and I had a number of different jobs in the IT department. Started out as just help desk, computer support. Eventually I became a database analyst, and for a brief time I was director of the IT department. When John Nowak left, I was voted interim director of the department until Roger Harrison came on.
I see. And the kinds of changes that you're wanting to make, you talk about a shift. I read briefly about that, but tell me more about what you. I guess it seems like you have a kind of a one campaign, a big overall arching issue that you'd like to see.
Yeah, it's basically access, equal access to healthcare, and really taking a really good look at the financial barriers to access. It's not, the problem with access is not uninsurance. That sort of dominated the conversation in the country for the last 50, 60 years. But plenty of people have insurance and they still don't have financial access to healthcare because they have a very high deductible and high copays. and their insurance only pays a portion of their healthcare costs. So lots of people are forced to choose between spending all their disposable income on healthcare debt and healthcare costs, or not going in. And lots of people don't go in, and they don't get.
So what would you have the hospital do that they're not doing right now? Because from what I understand, Jefferson Healthcare has one of the highest charity care levels in the state. In fact,
Yep.
It was actually one of Mr. Glenn's issues with initially when he took over, that he was going to take a look at charity care, and it's still sort of been put aside, I think, and not talked about openly as much as, say, Epic and the affiliation with Swedish and a lot of other things. So what do you see that they should do differently that you'll be advocating for, and what would be the cost of that?
Yeah. So I spent a lot of time studying the charity care and the bad debt numbers at Jefferson Healthcare, and it's true, we have some of the highest percentage charity care of any hospital in the state. Charity care is not a solution to the financial access problem. We need different solutions. San Francisco started a program called Healthy San Francisco, which was really innovative. It basically created a type of community healthcare service, which was similar to insurance, but it just looked at your income and gave you a reasonable amount to pay, and you paid it, and then you had access to the majority of healthcare that you would need, as long as you went to a healthcare facility that was participating in this. So I mean, there's
that's sort of like group health.
Yeah, it could be. It's
an insurance program.
Yeah, but it wouldn't actually be insurance legally. That's what San Francisco did, and actually Howard County, Maryland, saw what they were doing, and they created a program kind of similar called Healthy Howard County. So I mean, that was really outside the box, innovative thinking.
And is that kind of what you're proposing?
Well, it would be if it wasn't for the Affordable Care Act. The Affordable Care Act changes completely the landscape. So, and I want to talk to the people, and I've made some calls to Howard County and San Francisco to ask what are they doing with the Affordable Care Act, because 5 years ago, Healthy San Francisco was a great solution. If you had no insurance, you could just pay $200 a month to Healthy San Francisco, and then it was like $20 for a doctor's visit or an X-ray. It was really reasonable things that people could afford based on their income. But that's not insurance. Affordable Care Act makes insurance legally mandated. So now those people they're in Healthy San Francisco, but now they might have to pay a big tax debt because they still don't have insurance, even though they actually have a solution for all their health care needs. So we have to now think differently. And so it's going to take some different solutions. And so I have some ideas of different strategies we could take that would fit with the Affordable Care Act.
Such as?
Well, okay, so with the Affordable Care Act, you're going to be legally required to get health insurance. And they have different levels of health insurance, from bronze, gold, silver, platinum. And if you don't have a lot of money, you'll probably get a bronze plan. It's a little more complicated than that, because if you're poor enough, then you'll have access to subsidies that'll make it a little bit easier. But there is definitely a gap there, where people that aren't quite poor enough to get fully subsidized health care and still have to pay a lot of out-of-pocket. So let's say you're one of those people that you don't really get much subsidy, and your choice is a bronze plan. It's going to pay 60% of your health costs. You may now still wake up one day and have a back pain, and maybe you see a doctor and they say, well, you need an MRI and you need this series of tests, and you know that's going to cost me thousands of dollars. I'm struggling to save money, so I might still not go in. I might still delay going in to get the care I need, because you have the cheapest plan, this bronze plan, and there are actually plans even lower than that. So what if we came up with a way to make it so subsidize people so that they could get at least to a gold plan or a higher level plan than they would have? So it actually makes the health insurance that they're legally obligated to get, actually something that breaks the financial barrier to healthcare. It could be something basically like that. I don't know. It's a lot that would have to get worked out to make it legal. We might have to get exemptions from the state. A lot of research would have to be done.
It's my understanding that the hospital actually is planning to hire someone to help people with Obamacare find the plan that works for them.
Yeah.
Is that similar to what you're talking about?
Well,
with,
that person's a navigator, and all they're going to do is sit that person down, show them the health exchange, and ask your income and say, okay, well, if you're below 400% of the poverty level, you get some level of subsidy. And they'll just say, so you can get these. Or if you are single and you make over $46,000 a year, you have to pay for the insurance. Mm-hmm. The cheapest one you can get is this bronze plan, and there's more expensive ones.
So it sounds like you're trying to find something within the hospital that's separate from the insurance plan?
It would be looking...
Is there money in the hospital's budget to do that?
No. Well, I mean, the hospital made a $4 million profit last year. So let's suppose we make a $4 million profit each year. Let's just maybe that navigator could sit down with a person, and instead of saying, well, the cheapest plan for you, and you say you're struggling with money even though you make $46,000 a year, you can get this bronze plan. You buy that and you won't get taxed on it. You still have to pay 40% of all your health costs. Maybe we give that navigator the ability to say, well, we have a program, we can actually get you into this gold plan at maybe a slightly more higher cost than the bronze, or maybe we fully subsidize it. That's basically...
So you're suggesting that the hospital put some of the money of the profits that it's making into access issues.
That is one possible solution. But what I'm suggesting is we should study the problem. We should make financial access to healthcare a top priority. We need to think about healthcare in a different way. It's like, imagine if we made people pay for the fire department to come and put out fires in their house, and the fire department said, well, 15% of the houses in the county, we're not going to put out fires there because they can't afford to call us. And that's just, the fire department's like, we got to protect our profits. I mean, it would be absurd if we're going to make emergency services with the fire department available for everyone. Then that's step one. It's available for everyone, and then we look at, okay, financially, how do we make this work?
It's just sort of trying to look at it a different way.
Yes.
You're looking at